anorexic.
Stephen Dalton, I see you listening very closely as Kat's talking about her situation. A lot of people hearing that story will think, how can it possibly be acceptable for someone who's clearly in crisis to be told you have to wait a year?
Well, I think what we do have, and I congratulate the two contributors for telling their stories, because these stories are not exposed enough. I think we need to understand that there are three problems which are driving this problem. I think we have a situation where doctors, nurses and other clinicians on the front line of services are providing excellent services, but they are simply overwhelmed by the numbers and they are not getting the support to deal with the demand. We have a postcode lottery of access, which your story clearly exposes. And the reasons for that is because we don't have any effective access standards and we don't actually have the investment in those services. So there is a financial crisis at the heart of the NHS, and mental health services, I'm afraid, are, despite all the rhetoric, are not receiving funding and are just having to make very, very difficult decisions on the front line of services.
Well, we just heard a moment ago, and you can correct me if this is wrong, that there will be some targets to do with mental health service, which presumably would bring in money, but eating disorders are kept aside from that.
Well, early intervention is very important, and we've heard people talking about the importance of early intervention, whether you're somebody in need or whether you're a clinician providing the service. And that early intervention would be driven by probably for younger people and children. So the government committed £1.25 billion for children and young people in the budget. We're now in the second year of that investment, and in fact hardly any of that money has reached the front line, and it's being used for other purposes.
Kat, what would you like to say?
I mean, it's great that there's been funding for children and adolescents, but obviously the group of people that constantly get left out of funding is adult eating disorder services. And obviously, when I sought help the second time round, I was an adult. Eating disorders don't stop at the age of 18. People can develop eating disorders at any point in their life. So it's also important to recognise that currently there's not any funding that's sort of coming that way, or very limited as well. So it's very, very difficult for someone like me, who's 26 now, to be getting access to treatment.
Mr. Dalton?
Yes, I mean, I represent people who provide services on the front line, and therefore I wouldn't disagree with what you're saying. We need comprehensive funding, and we need accountability, because there has been funding. There has been funding for, you're absolutely right, it's not just about funding for young people and children, it is about funding for adults as well. So we've also had commitments in this year for new funding for adults, but what we need is greater accountability and greater transparency, because clearly the funding isn't reaching the front line.
Ms. Dalton, thank you very much for your time this morning.
Kat, how are you doing now?
So fortunately, my parents were in the position to be able to finance outpatient